If you're going in the medical field, you got to be ready to deal with what you're going to be working with now. So in other words, we're going to be training you to prepare yourself to go out in the world of COVID. It's going to be hard. It's going to be tedious, but it's rewarding as well. Safety is a must. Seriousness about your craft is a must. So you got to be here. You got to learn. Look at the patient as if it's your own family member and how you would want them to be treated. My name is Lori Bedford. I am the Medical Assistant Coordinator here for Centura College in Virginia Beach. The majority of my medical training was a healthcare provider in the U.S. Navy. It's a very important program right now, especially in the medical field, as you know, with everything that's going on. The medical assistants, they pretty much run the outpatient clinics. Outpatient clinics can't survive without them. They're a very crucial part of the medical care team. So they learn everything from doing phlebotomy, EKGs, assisting in minor surgery. It's a lot that they learn within the time frame that they're here. And it's very rewarding when they actually get out there and work in the field. They were learning how to perform the phlebotomy or venipuncture. It's more than just getting a needle and sticking it in somebody's arm. First of all, they got to have a basic understanding of the anatomy, where the veins are located. They learn on the artificial arms first how to handle the needles correctly and safely. Once they're feeling a little comfortable, they graduate to each other. And the reason being that we do live sticks here is that you can stick a needle in a plastic arm all day long and you'll hit the target. But everybody is different. The presentation of how the veins are in the arms are different. So it's good to have them do it in a live setting on each other so they can get used to how different patients present and how to troubleshoot for that and possibly be able to have a successful phlebotomy procedure with those different type of presentations. They also are learning today how to do certain other rapid testing, the glucometer, which is crucial for testing for people who are diabetics. They're learning how to do a rapid mono, and of course the rapid strep testing. All of the students are nervous. That's something we can work with. Nervous, we can work with. We try our best to calm them down. Like the ladies that I'm working with now, and when I told them tomorrow we're doing live sticks, their eyes got big. I was like, you can do this. And the students just have to be honest about their fears and their concerns. And I usually pick the most nervous student and roll up my sleeve. If they draw blood on me, that is such a big confidence booster for them. And then I let them know, you didn't hurt me. So with the proper coaching and the correct environment of encouragement, not negativity, they'll do fine. That's what I normally do when I'm doing my phlebotomy class. They can work in any urgent care clinic. They can work in specialty clinics like dermatology, psychiatric, orthopedic, assisting with the doctors with procedures, checking patients in, doing their vitals, and even doing some laboratory procedures. It's a joy to see them go from not having any medical skills whatsoever to making sure that they're ready to go out there on an externship site and not only just do well, but dominate. Some of our externship sites can tell the difference between a Centura student versus another type of student from another school. They know the difference.